Hey, it's Shilpa Bharaskar here today, and I want to actually address a question that I had on one of my blogs. And the question was um, on a blog where I explained the stages concept. And this is not a question which I have had just on that blog. I've had quite a few emails over the years where I've seen practitioners actually get very confused about the danger of suppression if we were to prescribe at stage one. And I think it's a very valid point. And I'll read you one of the blog comments here. And what this lady says is, I wonder if there is a danger of suppression if we were to prescribe based on stage one or two symptoms. For example, if somebody has migraines whose modality is confirmed to sanguinaria, but the constitutional remedy from stage three intake is arsenicum. So if we were to prescribe sanguinaria instead of arsenicum, will the migraines disappear only for something more serious to show up later? I think that's a very good question. And if you step back, I've seen a lot of people get confused and at times emotional about this. They really get tied up about stage one tools. And the reality is that stage one provides us just a bunch of tools. It is definitely not a shortcut to homeopathic case management. And as any other tool in homeopathy, it can be used well or it can be used poorly. It can be used for healing or it can be used for suppression. And the thing is, if we did not have stage one tools, we would not have had answers for majority of the one-sided diseases when well-indicated medicines are not an option. We would have had no effective tools for repairing damaged organs, for removing obstacles to cure, when well indicated remedies simply do not work. We would not have had anything to offer in those end stage diseases where there is nothing but pure disease picture. And we would not have had effective homeopathy for the masses or quick pain relief when time is critical. We would not have had progress in homeopathy because pretty much the majority of the patients who walk in your clinic today have had at least one over the counter homeopathy prescription that got them introduced to homeopathy in the first place. So think about it. It's stage one homeopathy that has driven homeopathy at the grassroots. So in that way, on a bigger scale, stage one tools are a blessing. But as a practitioner, you have to get good at using them. But more importantly, you have to get good at being able to choose stage one tools wisely and intelligently when needed. So if I look back at my own journey, my first introduction to real stage one homeopathy, when I really had to, go in at the deep end, was when I started my rural practice. And I saw those pathological cases. And at that point, I had a mission to help people get that pain relief. I wanted to help them avoid that expensive trip to the doctor that could take them away from their next meal, or have a surgery that could finish off their life savings. But now in my current business, where I'm working exclusively at stage 3 and 4, I just want to avoid the stage 1 conditions, blocking the progress or stagnating their journey or preventing all the good work that I've been doing with deeper stage 3 and 4 remedies. So stage 1 tools are a critical part of their journey to provide them the ultimate outcome faster and much more efficiently. So they are like, it's like fast tracking their progress. So I understand when we start, we are just trying to use a tool, the best one we know, what we have learned at school. And from what I have known, the majority of the successful practitioners have one thing that's very common, is that they start off with one tool, but they quickly move on to using tools across the spectrum of homeopathy. That's so much, it's tried and tested, and I've seen it again and again, that they choose a tool to suit their patients. I've seen people use stage 1 tools badly. I've seen them use it as a shortcut for everything and spoiling really good homeopathic cases, which could have worked beautifully at other stages. And I've seen people use stage 3 and 4 tools for conditions that actually needed stage 1 tools and driving away their patients because they were so adamant to use stage 3 and 4 when the patient did not really need them. So what I've done is I've created a mind map, all right, for you to help you identify what to do or when to use stage one tools, what tools to use, and what could create a suppression and what does not create a suppression. So I think that could just help you really bring it all together and help you better in your practice. Okay, so let's look at some of the typical stage one scenarios where people would want to use, a stage one tool. And we have two main issues here. And I've just divided them into two different types of places where things would cause a suppression and where it's unlikely to cause any suppression. All right. So let's look at what could cause suppression. And the main thing is when you are actually treating a stage 3 and 4 condition with a stage 1 tool. So, for example, if you're treating some local affections on the external parts using a local stage 1 remedy, like skin eruptions or ulcers or warts or growths, or even as that lady talked about in the comment section, a migraine with a local remedy. So what you're looking at here is you think these are local conditions, but they're actually stage 3 and 4 conditions which have an expression on external region, and you are trying to use a stage 1 tool, a disease specific remedy to take care of them. Now the reason people could do that is because the case taking is incomplete. So it could be due to lack of training or it could be due to lack of time, but people just take what they see, especially when they come from a conventional background and they're trying to get into homeopathy. This is one common stumbling block when people are going through that transition. Now, I do admit that there could be some conditions which are these localized conditions which have come up from a more deeper disease, but do whatever you can, you just cannot have any more symptoms. There is just a single wart, there's nothing else, or there is just an ulcer on some part of the body and there is no other symptom no matter what you do. And those are like true one-sided diseases. And I think it has been mentioned in the organon that in that case you just take what you have and prescribe on what you have. It's like you give a partial similimum in that case because that's what you can do, and then the picture unfolds and then you can move on into a zigzag type of a cure. But in that case you don't just stop at that one single prescription. You unfold the case and you look for deeper and deeper remedies that bring about the whole cure. So that's the whole idea. And then you could have non-verbal patients, in infants and animals, where you just do not have the full picture for so many different reasons. And in that cases, you are actually treating local affections with localized remedies. So if you continue to do that, then a prolonged treatment in such cases could cause a suppression. It's not a rule in every case. Every person is different and the types of suppression can change depending on the host. But yes, there is a possibility of suppressing a condition if you just treat the localized affection or a local malady without looking at the internal disease. This is a typical scenario, right? But there are conditions which are pure stage 1 conditions where it's unlikely for you to create a suppression. And let's talk about those. The first thing is the acute first aid conditions. So acute first aid conditions, or what I call a pure first aid conditions, are issues where you have a one-off external cause or some sort of a mechanical obstacle which has created the problem. So the problems come from without. It comes from outside the body. Any injury or any fracture or any foreign body that's been stuck in a particular location, dislocations, burns, lots of bleeding after an accident or loss of vital fluids or mental shock because somebody has lost someone right now. It's an acute grief or an acute disappointment. Somebody's gone a surgery. So all these conditions which are from the external cause which has created a problem right now and the person is being affected by that, that's one place where you can think of a stage 1 remedy which is localized just for that particular issue. You can give arnica in that case, or you can give, symphytum, or you can give something like cantharis for burns. So all these conditions, you are looking localized for just those few symptoms that you get because it's an external condition. Now you have to be wary here that if there is a tendency to have fractures, or if there is a tendency to have dislocations, or if there is a tendency to have grief, then it is not just an external condition. There is something internal playing a role as well. And in that case, you might want to also work at a deeper level. So that's just one criteria here. Let's look at the other stage 1 conditions, which are pure stage 1. And that is when you have something where it's a product of an end, it's a product of a disease which has got a gross pathology. It's like an end product, right? So, say for example, somebody has organ damage and pathology because the disease has reached a stage where the organ is now damaged, say ovarian cysts or uterine fibroids or liver enlargement or some gallstones, renal stones, prolapse of the organs. So in such cases where the disease has progressed to a level where now there is an organ which has been damaged, and that is like a mechanical block to, a stage 3 or 4 remedy working really well. It will work, but it might take a long time to reach the level where it can reverse the pathology. In that case, a stage 1 remedy which can repair the damaged organ at that local level might just boost up the whole treatment process very, very fast. So that's one place where it's really quite judicious to use a stage 1 remedy just to work at an organ level there. And this is something I've used very, very successfully, where you give 2 different remedies at the same time, or you just start off with the stage 1 remedy and then continue to stage 3 and 4 later on. And then there are those conditions where you have the end stage disease, where the vital organs are damaged and it's a terminal disease picture. So where you have end stage renal or liver or cardiac or lung diseases, or the extreme vitality is low and the person could be hospitalized or comatose. Now, in such cases, all you have is a diagnosis. There's nothing else. And most of the time, homeopathic potencies might not even work. You might have to actually give them a remedy in really, really crude form, or it could just be a palliation. So the same remedy can work as a palliative. So there's nothing before, there's nothing peculiar, there is no stage 3 and 4 symptoms at all here. So that's where stage 1 is what's indicated. It's all you can do, right? And then comes a whole new syndrome, which is actually majority of the stage 1 conditions that you can see in a normal day-to-day practice, right? And that's what I call a stage 1 layer, or a never been well since syndrome, which is a product of suppression itself. All right, so there are 4 different types of suppressions that you can actually have. You can create a stage 1 condition, and that could be a physical suppression where you are suppressing an infection or a discharge, using antiperspirants or using antidiarrheals, or suppressing an eruption. So basically, when sometimes when you're using antipathic ways, or you can using a homeopathic way, like this localized thing, after a long time some people can go into that suppression, and that could be sort of a suppressed layer where you need to actually work at that suppression and help that patient unfold. So this is where you can, which what I call a stage 1 layer, where you have to first reverse this process, get this thing expressed before you can unfold, where you can just need a stage 1 remedy like an antimiasmatic remedy, for example, or an intercurrent or a nosode. Yeah. In these cases, another type of suppression is a mental suppression, where a strong emotion has been suppressed and the person has never been well since that point. So in that case, until that anger or the disappointment or that grief has been expressed with a strong antimiasmatic remedy, that whole layer nothing works. Well indicated remedies do not work in that case. So that's the type of layer that we're looking at. So unless this thing unfolds, you cannot work at a deeper level before that. Another type of suppressions, which is basically most of the stage 1 patients would be a vaccination damage, or because of antibiotics or steroids, or hormonal therapy, or OC pills over a long period of time. In these cases, people who come with infertility with a prolonged history of OC pills do absolutely beautifully on folliculinum, or with vaccine damage, and there are so many vaccine nosodes which work beautifully in these patients. So all these types of cases, you need to actually work at that isopathic, whatever you call, at that sort of stage 1 level to get that suppression picture away before you can work on the deeper patient, because that's a block to cure. And then sometimes you can have a surgical suppression. Organs are removed during surgery, and the person has never been well since that particular surgery. Something is disturbed in their body, and you have to actually, restore the hormone using a sarcode, or using some form of. So nosodes and sarcodes play a huge role in such stage 1 layers, and that is a whole genre of diseases that we are looking at homeopathically, that have such a huge, that homeopathy works so well at that level. And these are the types of conditions which you actually look at when you're treating a stage 1 condition. Okay, so hope that gave you a good insight into the scope of stage 1 homeopathy. Now, if you have an aversion to stage 1, or it just creeps you out, because you think it would suppress, then you just have to get past that. Because when you have a real stage 1 condition, and it is the only tool that would work for you, there is no way you can have any other further information. And most of the time, the patient's condition is the end product of a suppression. All those not been well since conditions are nothing but suppressions, where you cannot do anything more, you cannot suppress anything more. There's nothing for you to do. You're dealing with damage that's already been done. You are giving them a hope to reverse that by working at that level. And there are times when no potencies can work at that level. You just have to go on pure diagnosis. You have to use those mother tinctures, you have to work with crude dilutions, doses that can stimulate that low susceptibility. And it is the best practice protocol for them. It is the best you can do for them. We're not trying to push them prescriptions, these prescriptions on patients who have a bunch of PQRS sensations. I think stage 1 is about working at a level that they are. It's about reaching at a level that they are. And it's about slowly stimulating them with doses they can react to. It's about building their susceptibility to a level where homeopathic potencies can act. It's about giving them a fair chance to get the best out of homeopathy as their system unfolds, so you can take them to the next level. It's absolutely not suppression if you know what you're doing and you're doing it judiciously. And that's my personal take on stage 1. And that's why I'm so passionate. It's changed my homeopathy. And that's why I bring in trainers, and I love the work of Dr. Joe or Dr. Isaac, who exclusively went on to create these systems for our patients to repair and drain those damaged organs, to remove that toxicity, to reverse vaccine damage. I will absolutely go that much further and say that stage 1 tools, when you use it right, when you use it for the right reason, for the right patient, it's absolutely a duty that you're doing as a practitioner. It is your responsibility to get good at it as a wellness practitioner. So I'll really love to hear your thoughts on this. When have you helped your patient using a stage 1 tool? If you have, I would love to, for you to leave a comment and let me know about that.